Cardiovascular disease, CVD, encompasses diseases of the heart and vascular system. The most prevalent diseases are peripheral vascular disease, specifically peripheral arterial disease and aneurysms, cerebrovascular disease, hypertension, and coronary artery disease. During the research conducted for this paper, it became clear that cardiovascular disease is the #1 cause of death worldwide. Health psychologists try to help those with a condition called metabolic syndrome, which presents as insulin resistance, atherogenic dyslipidemia, hypertension, and central obesity, or abdominal fat, and is associated with elevated risk for diabetes and cardiovascular disease. Central obesity negatively affects insulin action and impacts how the body rids itself of glucose. In the body's attempt to cope with these changes, it disperses free fatty acids. One of the consequences of this is that triglyceride accumulates in the liver and the muscles, which leads to insulin action being depressed while levels of ApoB containing lipoproteins are increased. This and other consequences of central obesity may lead to inflammation, which contributes to cardiovascular disease as well. According to a study on risk factors for CVD by Sherry Waldstein and Merrill Elias, modern guidelines for blood pressure are 140/90. Data collected revealed that women who are healthy would probably not suffer any significant rise in blood pressure if they were to have only one alcoholic drink per day. But women who increased their dose to 2 or 3 showed an increase in both systolic and diastolic blood pressure. While women had no change in blood pressure at 1 drink per day, even 2 drinks per day for some studies, and some evidence even suggested a lowering of blood pressure, males who drink even 1 drink per day were found to have higher blood pressure than those who abstain. According to this study, in the year 2000, hypertension had a prevalence of 50 million in the US and accounted for 35% of atherosclerotic events. Hypertension even influences brain activity. This influence has been named hypertensive encephalopathy. Medications utilized to normalize blood pressure themselves cause cognitive changes. Hypertension is a predictor of poor psychological function compared to that of normotensives. This holds especially true in the domains of attention, learning and memory, and abstract reasoning. On a side note, those prone to depression or hostility are at an increased risk for cardiovascular disease. A study examined whether an association exists between workplace bullying and violence and cardiovascular disease. The study is often referred to as DWEX, or Danish Work Environment Cohort Study. It was discovered that these 2 types of occupational trauma are clearly associated with CVD, as well as type 2 diabetes. Bullied persons report depressed moods at a rate some 300% higher than non-bullied individuals. During this research, I came across a lot of things that could be considered risk factors for CVD. There's much too much information for me to share in 5 minutes, but I'd like to finish by discussing someone else's theory on the development of cardiovascular disease. In 1856, a chain of events began with German pathologist Rudolf Virchow discovering lipid accumulation in arterial walls. Next, in 1913, a study by Nikolai Anechoff showed that rabbits fed on cholesterol grew lesions in their arteries that looked like atherosclerosis. Cholesterol appeared to be the culprit in atherogenesis. Since then, there have been many studies that back this up. I believe this to be true, and after researching this topic endlessly, I believe that it is the main contributor to CVD. In closing, a study by Rami Salim Najjar and Andrew Gewurtz investigated whether a plant-based diet could be effective to reduce CVD.
The answer was a resounding yes.